My name's Mia Everett. I am the Interim Senior Medical Director at CBH, and I'm also a child psychiatrist, board certified as well as adult psychiatrist. Well, I'm a native Philadelphian, born and raised, but I've done medical school, college, and some of my training outside of Philadelphia and Atlanta, Boston, and New York, but always knew that I'd like to come back to Philadelphia at some point. When I think of Women's History Month, I really think collectively about all of the amazing women that throughout my life have really impacted me and society. I was raised primarily by women, and my mom was mostly a single parent, and she also became a nurse very early in my childhood and initially worked in psychiatry. She always had a love for that field, really relished being able to help the marginalized, especially those who suffer from serious mental illness. She's always had like a caring and serving heart, and I think that's probably been the best thing that I've kind of inherited or learned from her. And so I try to employ like a servant leadership model in all that I do, both when I'm seeing and treating patients more and also in the work that I do at CBH. I think I've been blessed by women who've come before me when it was even more difficult to become a physician, and particularly a Black female physician. I had great mentors in terms of physicians who provided opportunities for me to shadow them as a high school student or in college, specifically great professors in science disciplines who kind of nurtured my abilities and encouraged me to pursue medicine. My initial mentor was actually the person who recruited me to join CBH. Her name was Dr. Camilla Jackson. She was our Deputy Chief Medical Officer for the first couple of years that I came to CBH. She's also an African-American woman who was a child psychiatrist, and so had done wonderful things at CBH, improved access to trauma services, and so she was definitely main support for me when I initially joined CBH. And then I've also been inspired by Donna Bailey and her roles as a leader, both prior to her return and currently. I think being a woman of color in a leadership space and trying to give voice to the marginalized in the day-to-day work that I do, those have always been the driving factors in leading me to go into spaces where I may not have been initially welcome, or where my abilities or place there was maybe questioned more than my colleagues or peers. So keeping that mission in mind has really given me the strength and fortitude and commitment to not being so focused on proving myself to others, but really doing a stellar job and trying to connect with people on a human level. Knowing the people that we serve enables us to really meet their needs. They're the experts on their lives. They're the experts on how they're feeling, what their material needs are, what their mental health needs are. And I think all of the things that they experience in their lives really informs their clinical presentations. And I think we can best serve them if we hear their voice and incorporate that into the work that we do, and not only incorporate it, but make it central to the work that we do.